everyone, and welcome. In this explainer, we're going to walk through the essential equipment for phlebotomy. We'll be focusing on the rules, the safety procedures, and some of those common errors you absolutely need to know, not just for your certification exam, but for your entire career. Okay, let's just dive right in. A perfect draw really does begin long before that needle even comes out of the package. A successful venipuncture isn't just about good technique, it's about having a systematic process that protects the patient, the specimen, and, of course, you. We're going to build your knowledge from the ground up, just like you'd set up your station for the day. So here's how we're going to break it down. We'll follow the logical flow of a real blood draw, from setting up your space and identifying your patient, all the way through the collection itself, and then landing on those crucial final steps that ensure quality and keep everyone safe. So let's start with the foundation. All right, Section 1. This is all about your immediate environment. We're talking about the tools and the setup that create a safe and efficient collection, all before you even say hello to your patient. You've got to set up your station for success. That means everything you need is organized, it's within reach, and it helps you maintain that clean, aseptic technique. And that phlebotomy chair, it's not just a chair, it's a critical piece of safety equipment. It stabilizes the patient's arm, sure, but more importantly, it reclines. So if a patient feels faint, you can manage that vasovagal episode quickly and safely, which is huge for preventing falls. Okay, so your station is set. Now we're moving on to what is, without a doubt, the single most important step in this entire process: positive patient identification. There is zero room for error here. This right here, this 4-step dance is non-negotiable. You have to do it every single time. You ask for at least 2 identifiers, like their full name and date of birth, and then you physically match what they say to their wristband and to your order. And this last part is so important. You label everything right there, right then. Never ever walk away from a patient with an unlabeled tube. Okay, lean in for this one, because this is a huge deal, especially for your exam. Wrong blood in tube is a massive safety failure. It can lead to misdiagnosis, the wrong treatment, and can cause serious harm to a patient. You can bet you'll see questions testing this. If anything doesn't match up, you stop. Period. All right, patient ID is locked in. Now the focus shifts to keeping everyone safe. That's protecting the patient from infection and protecting yourself from exposure. This means proper personal protective equipment and site prep. This is one of those classic exam questions, so let's lock it in. It's super simple. Antiseptics for people. They clean living skin. Disinfectants for things. They clean your chair, your cart, your work surfaces. You would never ever use a disinfectant on a patient's skin. And this really breaks it down for you. That's 70% alcohol for a routine draw. You have to let it air dry completely. Don't fan it, don't blow on it, just let it do its job. That's what activates its antiseptic properties, and it also keeps it from stinging the patient or causing hemolysis. And for something like a blood culture, the prep is way more intense to avoid any contamination. And this is another one of those bright, flashing red lights for your exam. Once you clean that site, it is a no-touch zone. I'm going to say it again. Do not touch it. If you slip up and you just have to repalpate to find that vein, guess what? You got to start all over again. Clean it again. No exceptions. Okay, the site's prepped. It's a no-touch zone. Now for the fun part. Let's get into the actual toolkit, starting with the tourniquet. You're going to see a few different kinds of tourniquets out there. But let's be clear. The gold standard, the one you'll use 99% of the time, is the single-use disposable one. Why? Infection control. Plain and simple. It prevents any cross-contamination between patients. Always make sure you're grabbing the right tool for your specific patient. So where does it go? Easy. 3 to 4 inches above where you're planning to stick. You're looking for that sweet spot. Tight enough to make the veins pop and easy to feel, but not so tight that you're cutting off all their arterial circulation. Okay, get your watches ready because this is a big one. You've got a 60-second clock ticking the moment that tourniquet goes on. 1 minute. That's it. Any longer and you risk something called hemoconcentration, which can totally mess up the test results. If you think it's going to take longer, just release it, wait a couple minutes, and then reapply. All right, let's talk about needle gauge because this can trip people up at first. It's all about this inverse relationship. Just remember this. The higher the gauge number, the smaller the needle. So a big number like 23 gauge, that's a tiny little needle, perfect for fragile veins. A smaller number, like 21 gauge, is your bigger, standard needle. So, matching the right needle to the right vein is a huge part of your job. That 21 gauge, the green one, that's your everyday workhorse for most adults with healthy veins. Get to know it well. Using a needle that's too small can actually shred the red blood cells. That's hemolysis and ruin the sample. Too big, and you can damage the vein. Now, here's a pro tip and a major exam alert. The colors on the needle hubs are super helpful, right? But here's the catch. They aren't totally standardized across every manufacturer. So, what's the rule? Always, and I mean always, read the gauge printed on the package. The color is a hint, the package is the truth. Okay, success. You've got the specimen. But hold on, we're not done yet. What you do after the draw is just as important for patient safety and for proper handling of biohazardous waste. Think of this as your post-draw choreography. It's a smooth 1, 2, 3 motion. Needle out, safety on, instantly. Then firm direct pressure with a sterile gauze pad. And please, do not use cotton balls. Their little fibers can get stuck in the site and pull the clot out when you remove them. And of course, the whole needle assembly goes straight into the sharps container. This is a big one, guys. This is about your safety. Never, ever recap a used needle. Ever. And if that sharps container is full, don't try to cram one more in. Just don't. Get a new one. It is not worth the risk of a needle stick injury. All right, let's bring it all home. We're going to look at the big picture now, the agencies that make all these rules, and why proper documentation is the final piece of the quality puzzle. So you've got these big players setting the standards. Think of it like this. OSHA is all about keeping you safe in the workplace. The CDC is focused on stopping infections for everyone. And CLSI, they're the guardians of specimen quality. Knowing who's who is absolutely key for your exam and for your daily practice. So at the end of the day, it all comes down to this one question. With every single thing you do, are you protecting your patient, your specimen, and yourself? Because mastering this stuff, well, it's about so much more than just passing an exam. It's about earning that trust that patients put in you every single day.